Hi everyone, my name is Taylor Loveland, and today I'll be presenting on the Glens Falls Hospital, which is the agency where I'm currently completing my social work internship. I will walk you through the hospital's history, the mission, the organizational structure, contributions to the community, areas for improvement, and finally, my own role as a social work intern. Glens Falls Hospital was established more than 120 years ago to meet the growing healthcare needs of the Adirondack region. The hospital began as a small community hospital and has since expanded into a comprehensive medical center, which, since 2019, has become a part of Albany Med Health Center. Over time, the hospital has grown in size and added specialized departments, expanded its emergency services, and developed community care programs. The hospital serves populations across several counties in upstate New York, including Warren, Washington, and northern Saratoga. It is a nonprofit organization, meaning its primary goal is to reinvest in patient care, community health initiatives, and service expansion. Glens Falls Hospital's mission statement is to improve the health of people in our region by providing access to exceptional, affordable, and patient-centered care every day in every setting. The Care Management Department operates within a hierarchical system that begins with the director, Stacy Hopkins. Stacy is a director of the Care Management Department, and her main priority is patient movement throughout the hospital. She oversees the department's fiscal side, tracking readmission and patient satisfaction rates, as well as other factors that affect the department's financial status. She is in charge of hosting monthly utilization management or meetings, where she and the committee ensure that the healthcare services are appropriate, cost-effective, meet patients' needs, and comply with Medicaid and Medicare regulations. Below Stacy is Jennifer Hart, the manager of the Care Management Department. Jennifer manages the department's staffing, including creating daily schedules and ensuring staff provide high-quality care and comply with healthcare regulations. She also works with vendors under contract with the hospital to negotiate terms and maintain the working relationship. Rebecca Pattonwade is the lead social worker. She trains all the social workers and care managers during onboarding and orients them to different floors and procedures. Rebecca works with the staff on complex cases and primarily helps with discharge planning on the floors. Michael Schaefer, who is my supervisor, is the weekend care management supervisor. He works mainly in the emergency department and ICU, but will support the floors if necessary. His responsibilities include discharge planning, assessments of patients needing rehabilitation or nursing home evaluations, referrals to skilled nursing inpatient facilities, and advocating for patients on a variety of issues. Additionally, he receives consultations from providers in the emergency department and ICU on patients who need access to resources, such as transportation, insurance challenges, behavioral health problems, and many other social work related cases. On the weekends, he works with other social workers and care managers to support them when needed. Stephanie Deshane is a social worker who focuses on complex care, including patients who have been hospitalized long term, and her primary responsibilities are discharge planning and coordination. She works with Rebecca on a majority of these cases. Kate Mew is a CASAC and works with patients who are suffering from substance use disorder. She also works with Rebecca on discharge planning for these patients and connecting them with resources, including referring them to treatment centers. She supports the emergency department, ICU, and the floors. Lynette Yalnovich and Jessica Evans are RN care managers. They work with patients to support discharge planning and coordination. Victoria Calogero is a care manager in the Snuggery. She works with families and mothers who have substance use disorder or need connections to resources such as WIC and Healthy Families, and coordinates discharges. She also reaches out to expecting mothers who have been deemed potential patients who may need assistance post-delivery and assist them with this as early as possible. Lastly, there's James Hudson, who is the utilization review nurse. His role includes working with insurances when patients are denied coverage or if their insurance is not paying the hospital. He works with all patients in the care management department and has a team of nurses. Charles Hospital contributes to the population in several ways. It offers emergency services, surgical care, maternity services, oncology, and behavioral health, which serve a significant number of patients. Additionally, it partners with local agencies such as the Visiting Nurses Association, or the VNA, and Compassionate Care to address issues of the aging population receiving care at home and transportation challenges, respectively. The hospital serves the greater community economically by employing hundreds of staff and serving as a training center for medical education and other areas. A significant strength of this team is its commitment to patient-centered care. They are always working together on the more challenging cases to ensure patients receive appropriate patient-centered care. They are dedicated to advocating for patients in every way possible and want to set them up for success when they are ready for discharge. Another strength is the cell phones that each member of the staff possesses. I know it's a weird strength, but it's a strength for many reasons. First and foremost, that it allows patients to access their providers and other staff members, such as us, the social workers, more quickly and with better quality. Instead of calling the hospital's main phone line and going through the long process of getting to the right person, the staff now has a direct cell phone number to give patients when a callback is needed, which is likely often. Additionally, my supervisor has a very long list of contacts in his phone, allowing him to connect with a significant number of resources. This makes it easier to advocate for and connect patients with resources. Having a dedicated CASAC staff member who assists in these cases is vital to the hospital. Kate just started working at the hospital a few months ago, and I can already see the difference that she makes. Patients are being seen and evaluated for rehabilitation and other services very quickly and efficiently, thanks to Kate's work. Also, she has created a list of inpatient and outpatient services that she shared with us all, and my supervisor also shared it with the emergency department. This makes a significant difference in the care the patients receive. The hospital uses Epic's Electronic Health Record, or EHR, system for documentation and patient charting. This system is widely used in this area and allows staff to connect with other providers in different agencies and hospitals to ensure consensus on patient care. My supervisor can refer patients to the most skilled nursing facilities in the area via Epic, making this tedious work more efficient and enhancing patient care. We can also read documentation from other agencies and hospitals, which helps us understand the complete picture of the patient's medical history and challenges. Lastly, the staff working in the care management department are thoroughly trained and seasoned in this work. They regularly complete trainings on hospital policies and have extensive knowledge of how the medical and social work systems intertwine. The department possesses many strengths. There are always areas for growth. Completing post-discharge follow-ups and with certain patients may be a crucial factor in whether they return to the hospital. Many patients are known for returning to the emergency department many times due to needs that aren't being met. For example, there was a patient whom I followed up with over the phone last week, as she had been to the emergency department 8 or 9 times within the last month because of recurring symptoms that they couldn't find a diagnosis for. She was referred to a GI specialist by her primary care physician, but she was unable to attend the scheduled appointment due to a lack of transportation. During that follow-up call, I helped the patient obtain a new referral to a GI specialist and another to behavioral health services. And also, she had already had medical transportation set up the last time she had been here, so she should be able to make the next appointment. Overall, if I hadn't made that call, she likely would have ended up back in the emergency department very soon. As an intern, this is part of my responsibilities, but my supervisor and the other staff do not have time to make these calls regularly. Completing these calls could significantly reduce readmission rates and improve overall quality of care. Patient education is a significant factor in readmissions and health literacy. An area for growth in the care management department may be to provide more education to patients who do not understand health-related issues or how to access resources independently, such as the Medicaid transportation services that patients, not just hospital staff, can schedule. There is high demand for social workers in the emergency department, yet only one is stationed there at a time. This is a significant area for growth, as I have seen firsthand how my supervisor has had to work on several cases at once, and how each one is more complex than the last. This can lead to burnout or compassion fatigue, significantly affecting patient care and staff mental health. Having 2 or even 3 social workers stationed in the emergency department would balance the workload and create a less challenging work environment. This goes hand in hand with the high caseloads, which can limit individualized care. Unlike clinical social work, the work in the emergency department and sometimes other floors can be very fast-paced. And if there's only one social worker assigned to the position, this limits the amount of face time each patient receives with us. This could lead to missing crucial information because we weren't able to spend as much time with each patient. One of the primary roles I have been assigned to is post-discharge follow-ups. This includes my work on the paramedicine program, which I have discussed in my weekly updates. This program focuses on older adults who may need more routine care, such as patients with COPD or who experience frequent falls. It focuses on patients who have been seen multiple times in the emergency department for these challenges and may prefer to receive their care at home rather than in the hospital. The local rescue squad provides this care, and it is free for county residents. I reach out to these patients and assess their interest in the program. If they are interested, I will send in a referral to the program and they will follow up with them. It's a community-based program that allows patients to choose how they receive their care. Additionally, I meet with patients and families in the emergency department and ICU to assess their psychosocial needs, including transportation, insurance, food insecurity, temporary assistance, housing instability, and much more. I advocate for patient rights by supporting their autonomy and respecting their cultural values, preferences, and decisions, even when they differ from medical recommendations. I connect patients to community resources, such as SNAP or HEAP, that help them meet their basic needs. Additionally, I communicate with their care team to create a safe discharge plan that involves the patient at every step. When my supervisor and I are assigned to the ICU, I participate in interdisciplinary rounds to learn more about the patients on that floor and listen for any who may need our assistance. Lastly, I document every interaction, referral, or intervention I provide to the patient to ensure that I am following the hospital's policies and procedures and acting ethically while doing so. Lastly, I would just like to say that I am able to submit my documentation to my supervisor through the Epic system, and he is able to review all of them and sign off if he thinks that the documentation was well written, or he is able to make suggestions to me and I can go back in and edit them. So that is a very great factor of the Epic system, is that he is able to monitor my documentation that way. This is my reference page with the Albany Med Health System reference on there. And that's my presentation. Thank you for watching.